Dr. Petra, thank you for coming in today to share your information with us. We would like to know why the chiropractor and craniosacral therapy pre and post frenectomy treatment is important.
Thank you, Dr. Hanny, for having me here today. The human body is an amazing, intelligent and complex jigsaw puzzle. Everything within it is intrinsically linked and works in an integrated way to allow for optimal function. If any functional restriction or inhibition exists, it's innately programmed to compensate elsewhere to allow for that function to continue. In the case of a tongue and lip tie, there's an overactivation of the surrounding musculature, which places unbalanced stress on the developing cranial and skeletal structures. Because the frenulum is a midline structure of the body, as is the spine and the nervous system, quite often when restriction occurs in the mouth, it's also noted in the spine. For this reason, having a chiropractor or other specialised craniosacral therapist release these areas of restriction enhances the outcome of the frenectomy procedure, allowing for the body to heal in a more efficient manner. Therapy performed before the procedure is specifically targeted at ensuring that the body is functioning in the best possible way so that it can optimally integrate the procedure. From a chiropractic standpoint, we're adjusting the spine and the cranial system to remove any areas of potential interference to the nervous system. This allows the brain to better control optimal healing of the body and allows the body to accurately relay messages back up to the brain. It is often noted from a surgeon's perspective that it is also easier to access the tissues in the area of treatment, especially the floor and the roof of the mouth, because the muscles and the soft tissue have been released and are therefore more relaxed. It's also noted that the child tends to be more relaxed for the procedure, generally because they're more comfortable too.
Well, Dr. Petra, can you explain to us how does a chiropractic adjustment happen to infant or child? Because there's a lot of confusion between the public about that.
Absolutely, Dr. Hanny. So a chiropractic adjustment for a baby or a child is very gentle, much like a soft massage essentially. Particular attention is usually paid to the areas releasing tension at the top of the body, near the skull, and at the base of the spine or the tailbone. These are the areas that the spinal cord attaches and tend to be the areas of greatest restriction within a child or a tied child. Furthermore, specific attention will be paid to release tension from the cranial structures, which is otherwise known as the skull, which also includes part of the mouth. The therapist will gently release these areas of tension with the amount of pressure known as eyeball pressure, just enough pressure to help release the areas of restriction without causing any discomfort to the child or baby. Therapy performed after the procedure specifically targets releasing the soft tissue restrictions that have compensated for the lack of tongue and lip movement. Detailed craniosacral exercises will also be given and demonstrated to the carers of the child so that they can continue to enhance the healing process at home. Ultimately, combining both body work, whether it be chiropractic or craniosacral therapy, and the procedure together ensures best patient outcomes. The procedure is going to be better accepted by the patient and healing will be enhanced post-revision. Clinical observation has shown us that patients who utilise both chiropractic or craniosacral care either side of frenectomy treatment have significantly less chance of needing further revision done. As practitioners, it's integral that we work in an integrated way so that we can achieve the best patient outcomes post-revision.
Fantastic. Thank you, Dr. Petra, for sharing this valuable information with us and with our patients. Basically, we try to get the maximum benefit for the treatment of these infants and children.